We want to welcome everyone for joining us today as we bring you the second webinar in our three-part series covering COVID-19 health and safety measures that the Boone County Health Department, District 100 and District 200 work together to oversee. My name is Jen Jackie, and I will be your facilitator for today's forum. Last week, we took a deep dive into COVID-19 health and safety measures being taken within the Boone County Public Schools. Today, we will provide updates that may have occurred since the last forum. If you would like to view the previous recording, you can find it at Forward Boone's website at forwardboone.org. Today's session is also being recorded and will be made available on the Forward Boone site as well. At the end of today's presentation, we will open it up to the public for questions. Questions asked during the presentation will be answered in the Q&A period. Next slide, please. Oh, that slide. Today's presentation is brought to you in collaboration with the Health Department, Belvidere, and North Boone School Districts and its many partners. It is my pleasure to introduce today's presenters from the Boone County Health Department, Amanda Mell, Belvidere School District, Dr. Dan Weisman, and North Boone School District, Dr. Mike Greenlee. Last week, they took a deep dive into the health and safety measures. Today, they again will provide an update, and the question and answer period will be at the end, but you can submit questions throughout the presentation. We do ask that you keep your questions informative, respectful, and constructive. We ask that everyone participating and listening in today works with us towards the same common goal of protecting students and staff and preserving in-person learning. Without further ado, I will turn it over to Amanda.
Thank you so much, Jen. Thanks to Forward Boone for hosting our second of three forums here. So just a real quick overview of the agenda. So our goals for these parent forums is to allow parents and members of the public to join us for a Q&A session after we present any updates. Last week, we spent close to 90 minutes going through all of the frequently asked questions that our respective departments and districts had received, and extremely informative. I know it is recorded and available on the Forward Boone website and Facebook page, and we'll continue to share that out widely so that as we get questions, we can help to answer it by making that recorded webinar available. We do have some progress updates both from the health department side and then from District 100 and 200 side. We'll just talk a little bit about ongoing next steps, and then we'll take questions. Next slide. Great. Next slide. Okay. So from the health department side, I would just say that we're excited to announce that we are onboarding some new contact tracing staff. We've made some new hires in the last week or so, and we're in our third day of training of some new contact tracers. It's going extremely well. We're really excited to be bringing these new staff members aboard. They are bilingual in English and Spanish, which really helps us when we're serving the community and doing contact tracing. Then we can provide more personal care in the family's native language. So we will continue to provide updates on our staffing patterns, but for now, things are looking really positive. So I wanted to make sure to share that. We do our weekly calls with both of our schools, and we'll be introducing the new contact tracers and getting them connected with the school point people for the contact tracing efforts going forward. Metrics are continuing to look good. We are seeing stabilization of youth cases and incident rates, as well as a slow decline in community transmission rates. So that's a very hopeful sign. We are seeing more youth becoming vaccinated and other adults choosing to be vaccinated at this time, which is also helping us to control the spread of COVID-19. We did receive some guidance changes and updates, which we'll be rolling out to our schools this Friday on our weekly call. And then that information will be made available, of course, on our website. When parents call our COVID-19 information line with questions, we generally direct them to the COVID-19 resource section of our website, which provides those guidance documents as well. As far as testing updates, I know that we have moved a couple steps closer with community-based testing here in Boone County using the University of Illinois SHIELD program. I know that both of our districts have some updates on that as well, but from the health department side, we're moving forward with hoping to offer a couple of community testing locations in the coming weeks to months. And then as far as our quarantine process through our contact tracing efforts with both of our schools, we have a uniform process that we apply across the board to both districts. And at this time, we've been using the early release 10-day quarantine option for classroom exposures only for students that remain asymptomatic and test negative. Because our numbers are trending downwards and our youth rates and hospitalizations numbers are stabilizing, we are moving forward on August 25th to go live with a 7-day early release quarantine option for classroom exposures only. I'm participating in some logistical meetings with both of our superintendents and district administration to talk through what that process will look like, and we'll be ready to go live on Monday, which is really exciting. That moves us one step closer to offering the test to stay option once we do have some PCR testing available in our schools and when 7-day early release quarantine is proving to be successful. So at this point, that's the health department update. And I will turn it over to next slide and next presenter. And just to clarify one thing, I think I might have said the month of August because I live in a time warp. What I meant was October. So Monday, October 25th, my apologies. Next slide. Great, I'll turn it over to Dr. Weisman.
Yeah, great. We appreciate that from the health department, the support that the health department continues to give us, and are grateful that the community spread is low enough now that we're able to all feel more comfortable with the earlier return options for families. As a school district, we'll continue to, by default, exclude students from school for 14 days, but then make sure that families understand that they do have an option to come back after 7 days if they meet certain criteria, and those criteria what we'll work through with the health department over the next few days before Monday hits. But generally, students should not come back to school early if they have symptoms, and they have to make sure that they're cooperating with any of the health department needs as far as communication and symptom tracking. So we're really excited about that and appreciate the support that the health department continues to give us. Like the community has seen decline, we also have seen a fairly significant decline in the number of students that are being quarantined. So we, the first month of school, generally we were consistently above 200 students being quarantined on any given day. And we've been under 175 now for a good week and a half or 2 weeks. So we're really grateful for that. And those numbers hopefully will continue to decline. Probably the other big update that I have for the community is around shield testing. So we have continued conversations with our school board and our community about the testing options that are available from different entities in the community. We decided as a school district to discontinue shield testing, or the relationship with shield testing. We had not started any type of testing in the schools through shield. Shield is an organization that really stems from the University of Illinois. They provide a non-invasive COVID-19 test. It's a saliva or spit-based test. Some people in our community have done shield testing if they went to the College of Medicine campus in Rockford, the University of Illinois College of Medicine campus in Rockford. They offer shield testing. So if you were interested at some point, in the last handful of months in a COVID test, but didn't want to get the nose swab, you may have gone to the shield testing site in Rockford. You can still do that as a community, but we are going to not follow through with any type of regular shield testing in our schools moving forward. The last couple of weeks, one of the new things that we have is that we have been following the state mandate and requiring that all of our employees be vaccinated or submit weekly testing results. And so you can see on our website, we have fairly high vaccination rates that we're grateful for, that allows our staff to continue to work in the schools and be able to follow through with the commitment and the support that we want to be able to provide our students in a safe environment. So we're really grateful for that, and for the staff that are willing to stay on board And even though those state requirements exist and submit to the weekly testing, we feel like it allows us to confidently provide a safe environment for our kids. And that's all I've got. I think I'm going to pass the presentation off to Dr. Greenlee.
Thank you, Dan. Thank you, Amanda. I hope I'm still there. Thank you. Really appreciate that. I too want to back up the metrics that Amanda talked about and Dan talked about. We had a great week last week where our positive cases were so minimal. It was great to see. And also our numbers in quarantine had significantly declined. So that was great news to see last week. We are also very, very positive about walking in to 7-day quarantines now with people that make sure that they follow and comply with those rules. So we're excited about that. We're really glad to see us do proactive things to get our kids back into school as much as we can. And then the last thing that I would say is for our parents there, just a reminder that if your kids are in quarantine, make sure you're working with your building and your building principals, because we do have remote learning available for those kids that are in quarantines. Make sure that you're in communications with your school and your principals, because there are options for you to make sure that remote learning is there for our kids in quarantine. So last thing that I'll pass along from our end is we still are in the process of working with Shield. However, we've taken a step here to make sure that we're redouble checking the processes. We want to make sure that data is accurate and consents are all in there. We're still working forward with that as a means to hopefully getting back in test to stay. We're also open to other options as well, but we just are making sure that we've got all of our ducks in a row and our process is airtight. So thank you very much for the opportunity to speak on behalf of North Boone.
Great. Thank you, Dr. Greenlee and Dr. Weisman. So our next steps are to continue our weekly parent forums for one more week for sure. We have one scheduled next week. We'll make sure that you all have that date before we conclude today. And in next week's forum, we'll give a weekly update from both school districts and the health department. We'll talk a little bit about some of the things that we're working on as we move forward. We'll continue to give updates on working towards shortened quarantines and the test to stay program option. I would say that the preliminary data that has been made available to me through the Illinois Department of Public Health from a couple of test to stay pilot sites that now have enough data collected to show the significance of that program are very positive. School districts that have worked their way successfully through the process of starting with the 10-day, moving to the 7-day, and then as transmission rates allow, moving into a very safely and tightly run test to stay program, have been very successful at keeping children in the classroom. So our goal as a health department is to work with both of our schools so that we continue that long game, right? As I mentioned last week, COVID isn't going anywhere anytime soon. I believe we will be dealing with it in future academic years. And so if we move our way through the process very smartly and we take slow but deliberate programs that allow the students to take advantage of in-person learning and extracurricular activities as safe and appropriate per guidance, then we avoid the risk of having an outbreak, having to exclude a bunch of students at once, having to walk back our processes or procedures, or take away activities and privileges because there's been an outbreak or there's been an exposure or a risk to our students or our staff. So I applaud the work of both school districts because we are successfully moving along that process to implement the shortened quarantines and the test to stay. I would also just like to say that one of the success stories as we see more youth and staff become vaccinated is they are oftentimes not subject to quarantine at all if they're fully vaccinated. So just to put a little plug into one of the benefits of vaccination is it does help to keep kids and staff in the classroom and involved in sports and extracurricular activities because it exempts a lot of the quarantine rules for those individuals. So that is a really positive reason to choose to be vaccinated if someone is still thinking about what might be those benefits. And that is it for this slide. Next slide. Okay, so John, I will turn it back over to you and Forward Boone. Thank you.
All right, so short and sweet today. So thank you guys for all of your information. We are now going to move into the Q&A period. So please feel free to enter your questions in the Q&A feature at the bottom of your screen, and we will answer those questions in the order they're received. So I'll go ahead and wait a second to see if we receive any questions, because we don't have any right now.
Dan, I think this is when you use your guitar.
A little background music, so.
Yeah, we could get some background music. Would you like me to sing as well?
Yeah, of course. Okay, looks like we have a question. Oh, we do. We actually have a comment. We got a comment from Holly that says, thanks for all your hard work. So thank you very much for sharing that with the presenters today. Anybody else have a question? Okay. Give it one more minute just to be on the safe side. And I apologize if my dog barks. Okay, it doesn't look like we're getting any other questions. Oh, here, oh, we do have one. What is the process for what is the in-person learning process for Belvedere?
Thanks for the question. So if a student is put on any type of exclusion for a COVID-related issue in Belvedere, there's really two different possibilities. If that student is a middle school or high school student, they will be able to use their Chromebook to log in to their video chat software and watch and listen to the lesson that's being given by their teacher. So they'll be home, but they can use the same schedule, the same times that their classes start and stop, and be able to access the materials that the other students access at the same time as their peers in their classroom. They're just going to be jumping in from at home in front of their webcam, and they'll be able to listen to their teacher as the teacher provides that lesson to the students and hear the questions that are being asked in class. That's for middle school and high school students. It's the same schedule. For elementary school students that are home, excluded from school for some COVID-based type of reason, theirs is a little bit different because in elementary classrooms, the students are moving around and the teacher's moving around. So the process that we have for them is there's a kindergarten remote class, a first grade remote class, a second grade remote class, all the way up through fifth grade for the whole district. And when a student in elementary school is home, they join one of those remote classes for the 10 days or 14 days or 7 days, depending on how long they're gone for the period of that quarantine. And the teacher provides live instruction for about 2.5 hours of the day. And then the rest of the day, the student is able to work on materials that are sent home by the homeroom teacher. So half of that time is spent on with other students in the district that are in the same grade. And they're getting live instruction, kind of like we're doing right now, just through video conferencing tools. And then the other half, the child is on their own working on homework or assignments that their normal homeroom classroom teacher would have sent them. Hope that answers your question. Thanks.
Okay, do we have any other questions? Okay, seeing none, we can go on to the next screen. So thank you again for attending today's forum. Again, this is part of a 3-part series. Next week on Tuesday, we will have our 3rd and final forum in this series. It will be at 11 a.m. on Tuesday, October 26th. Our main focus going forward will be to answer questions from the public on school safety and how we can continue to work together to make our schools safe while providing the children in our districts with the best education. Again, this will be recorded and it will be put out on forwardboone.com. And finally, if you ever have some questions and we aren't doing one of the forums, you can always reach out to either the districts or the health department with the contact information here. So with that, we will go ahead, and I want to say thank you to our presenters and thank you for the attendees. And we will go ahead and close it out for tonight. Thank you guys so much.